For years, you may have the same doctor, same insurance, even the same routine treatment, and then suddenly get hit with a much higher bill from a hospital. National investigative reporter Carice Jackman and partner KFF Health News explains one of the reasons that's happening more frequently.
I think we are set to go.
Rolling. All right.
All right, I'm going to start recording now on my end. Recording in progress.
Cervical dystonia and dystonia, other forms, it's very painful. So muscles are in constant spasm and contraction. You know, my head is in constant motion, my shoulder is in constant motion.
Is that why you're holding your neck, Karen, to keep your head still?
So if I remove my hand, my head is going to go to the right, it's going to tilt to the right, and my shoulder will come up.
For 5 years, Karen Blanzy regularly received treatment for her condition at a medical clinic in Grand Rapids, Michigan. Her insurance paid 100% of the cost. That was until February of this year. Instead of her bill saying zero, Blanzy had a balance of more than $1,100.
They said that it was just some changes that they had made. My insurance company said the same, and that it was a revenue code. They had switched from billing as an office visit for treatment, and they switched it to outpatient hospital services.
And there was nothing different about your treatment?
No.
Same provider, same doctors, same nurses?
Yep, same place that I had always gone. Nothing had changed.
Blanzy's clinic is owned by Corewell Health, a big health system that is the result of a merger a couple of years ago. At the end of last year, Corewell announced to patients that some clinics would now be owned and operated by the hospitals. In December, Blanzy got this letter from Corewell Health about the billing changes, stating that she can expect to see 2 charges on her statements from them in the future, and that the clinic will begin provider-based billing. The letter says even though the clinic or practice Blanzy went to may be located several miles away from an actual hospital, the facility itself may be owned by the hospital or considered part of it. Corewell added this is common in large health systems, where the hospital system owns the space and employs some of the team members.
For them to change the way they bill it and say that it's a hospital service as an outpatient, it just didn't make sense to me.
Investigate TV reached out to Corewell Health for an on-camera interview. Corewell confirmed late last year Blanzy's neurology office became a hospital outpatient department owned and operated by Corewell Health Grand Rapids Hospitals, and stated the change was not a result of the merger, but they declined to discuss her case due to patient privacy and didn't explain the coding.
And look at this, look at this nonsense.
Dr. Elizabeth Rosenthal, senior contributing editor of our partner KFF Health News, isn't surprised. She says hospital charges for non-hospital care is a concern she hears from patients all the time.
Care physicians working for a hospital or in a practice owned at least partially by a hospital or healthcare system increased from 29% in 2012 to 41% in 2022.
And we see this over and over again. The rebranding of doctors' offices, of outpatient clinics as hospitals for the purpose of billing.
And should the burden of that transition, that change, fall on the patient?
Well, how's a patient to know? One of the hospitals I went to asked patients to sign a consent form beforehand saying, you realize that as of this year, we're going to be charging you a hospital facility fee. But I have to say that was in a hospital. This was not. So I think it's another one of our buyer beware warnings in healthcare.
As for Blanzy, she can't afford to pay over $1,100 every 3 months. Her treatments have stopped, while her contractions and muscle spasms continue every day.
I'd like to see them be more transparent. The bill is mine. I don't think I can do anything about that, but I can't be the only person that this has happened.
So the cost of care is the last thing on a patient's mind.
Our national team reached out to the Center for Medicare and Medicaid Services about the issue. A spokesperson said in a statement the agency recognizes how this confusion can lead to unexpected bills for patients. They're working with other agencies to get patients' cost estimates before treatment, especially with those who have commercial insurance. If you have a story, we want to hear from you. You can call us. Best way to get a hold of us, email our investigators there at the address you see on your screen. We'll look into your issues for the next Factfinder Investigates.
Whoa, is this your new Nissan Rogue?
Yeah, crazy story. Yesterday, I was at the Nissan